Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I'm pleased to welcome you to the multimedia summary for the journal's November 2020 issue. There are 4 articles that have been selected as our Editor's Choice or Highlights articles this month. Our Editor's Choice this month is a consensus recommendation entitled Anticoagulation in COVID-19, a systematic review, meta-analysis, and rapid guidance from Mayo Clinic. It is authored by Dr. Robert McBain from Mayo Clinic in Rochester, Minnesota, and colleagues from Mayo Clinic in Jacksonville, Florida, Scottsdale, Arizona, and the Allegheny General Hospital, Pittsburgh, Pennsylvania. Shortly after the spread of COVID-19, it became apparent that patients with this disease were at an increased risk for coagulopathy and thrombosis, the latter occurring as described in some patients despite seemingly appropriate anticoagulant prophylaxis. In the present issue of Mayo Clinic Proceedings, McBain et al. Provide a systematic review and meta-analysis of relevant literature that address these considerations. Beginning with more than 4,000 citations, these authors culled 37 studies based on such predetermined criteria as number of participants, assessment of the coagulation profile, the effect of anticoagulation strategies, and documentation of relevant outcomes. Where possible, meta-analyses were undertaken. The findings indicate that in COVID-19, there is a propensity to such abnormalities as elevated levels of fibrinogen and elevated D-dimer levels, prolongation of the prothrombin time, PT, or activated thromboplastin time, and thrombocytopenia. As pointed out by McBain et al., COVID-19 associated coagulopathy, CAC, differs from disseminated intravascular coagulation, DIC, because in CAC, fibrinogen levels are elevated, not decreased as in DIC, and the pro-time and platelet count are only mildly prolonged or decreased respectively. Patients with severe COVID-19, as compared with those with milder manifestations, are more likely to exhibit elevated D-dimer levels and thrombocytopenia. The occurrence of thrombosis varied substantially, 2% to 69%, with a lower rate occurring in a study in which clinical assessment led to imaging studies, whereas the higher rate was described in one study employing mandatory surveillance ultrasound imaging. For those studies reporting a higher incidence of thrombosis in patients in the ICU with COVID-19, such incidence is substantially greater than is generally expected for similarly ill patients without COVID-19. McBain et al. Summarized findings from available studies regarding the rates of venous thromboembolic disease, VTE, and outcomes in patients receiving prophylaxis dosed and therapeutically dosed anticoagulation therapy. Based on such analyses of the literature and the input from experts in thrombosis, hematology, cardiovascular medicine, and pulmonary and critical care medicine at Mayo Clinic, McBain et al. Provide a consensus approach that addresses the prevention of thrombosis, including such considerations as whether the patient is already on anticoagulation therapy for a specific indication, how prophylaxis is preferably achieved such that the risks of bleeding are minimized, the need for daily clinical evaluation for VTE and where indicated imaging studies, laboratory evaluation, assessing the risk for VTE and how increased risk lowers the threshold for imaging studies and tailors the type of prophylaxis, and finally, whether prophylaxis should be continued following dismissal to the outpatient setting. In their consensus approach to the treatment of thrombosis, McBain et al. Underscore that in patients in whom VTE is confirmed, the therapeutic approach should generally follow practice guidelines for VTE in patients without COVID-19. They discuss the uncommon instances when thrombophilia testing, such as lupus anticoagulant, may be indicated, and they delineate key considerations underlying the assessment and management of patients who have failed to respond to anticoagulation therapy. The authors emphasize that the certainty of evidence in the literature is, broadly speaking, quite low, And in this regard, they point out the unaddressed and unresolved questions in this field. Finally, they outline mechanisms that promote a thrombogenic state in COVID-19, several of which involve the endothelium being transformed into a prothrombotic surface because of endothelial activation and/or injury caused by SARS-CoV-2 infection, complement, cytokines, hypoxia, or angiotensin II. McBain et al. Are to be commended for undertaking this timely and important analysis and providing these needed consensus recommendations based on the currently available literature. Our first highlight is an original article entitled Correlations Between COVID-19 Cases and Google Trends Data in the United States, a state-by-state analysis. It is authored by Mr. Shyam Kurian and colleagues from Mayo Clinic in Rochester, Minnesota. In introducing their novel observations regarding the COVID-19 pandemic, Kurian et al. Provide the backdrop of infodemiology and infovalence, terms that describe the analysis of data available on the internet that are relevant to public health and healthcare policy. In this regard, please see reference 4 in this article by Kurian et al. These authors applied these analytical approaches to assess the occurrence of cases of COVID-19 state by state, as well as collectively for the United States. And to this end, they employed the web-based data available in Google Trends. Google Trends is a vast repository of data based on specific internet searches that can be analyzed either in real time, that is over the past week, or in non-real time, that is data that go back as far as 2004 to almost the present. Kurian et al. Drew upon data obtained from January 22nd, 2020 to April 6, 2020, and selected 10 keywords that relate to COVID-19, including those pertaining to the main symptoms of the disease, diagnosing the disease, and how the spread of the disease may be minimized or prevented. These authors employed the database from Johns Hopkins University Center for Systems Science and Engineering that provides not only the total number of COVID-19 cases and deaths, but also those that occur on a daily basis. These data are gathered on a county-specific and a state-specific basis in the United States. Among the salient findings in this study by Kurian et al. Are the following. First, certain keywords tend to have their own temporal profiles of usage, as for example, face mask steadily rose over the time frame studied, while other keywords did not. Specific keywords were more commonly used when COVID-19 cases were lower and others when COVID-19 cases were higher. Second, when analyses were undertaken for the entire United States, 6 keywords had moderate correlations and 3 keywords, namely face masks, Lysol, and COVID stimulus check, had strong correlations with daily new cases. 4 keywords exhibited significant correlations when analyzed for individual states. Third, additional analyses were undertaken by Kurian et al. To determine lag correlations, that is, over a time frame of 16 days prior to the appearance of the first case, and lead correlations, that is, over a time frame of 16 days following the appearance of the first case. Most of the keywords had moderate to strong correlations in the days preceding the appearance of the first case, with declining correlations thereafter. Such correlations tended to vary by state. In Florida, for example, strong correlations were exhibited by virtually all of the 10 keywords prior to the appearance of the index case of COVID-19. The importance of the study by Kurian et al. Is that it shows how certain keywords used in internet-based searches not only correlate with cases of COVID-19 in the United States, but also antedate the emergence of such cases in specific geographic states. Because these data can be gathered in real time, they may possess an immediacy and timeliness otherwise lacking in traditional methods for disease surveillance. Such data may thus aid strategies that seek to forecast and restrain the spread of the disease, and to judiciously apportion resources in caring for patients with COVID-19. Finally, the study by Kurian et al. Provides a persuasive example of the power and scope of infodemiology and infovalence in the service of healthcare policy and public health. Our second highlight includes two articles, a commentary entitled Shell Shock and PTSD, a tale of two diagnoses that appeared in the September 2020 issue of Mayo Clinic Proceedings. It is authored by Dr. Mary Vance from the Uniformed Services University of the Health Sciences in Bethesda, Maryland, and Dr. Joel Hall from the University of Michigan in Ann Arbor, Michigan. The second one is a special article entitled Stress and Fear, Clinical Implications for Providers and Patients in the Time of COVID and Beyond. It is authored by Dr. Ludmila Karnatskaya from Mayo Clinic in Rochester, Minnesota, and colleagues from several national and international institutions in the United States, the United Kingdom, Canada, and Hungary. In their recent article, Vance and Howell discussed the functional compromise and sequelae caused by PTSD and traced the original recognition of a type of PTSD to shell shock incurred during World War I. The current global crisis caused by the COVID-19 pandemic imposes its own unique shock and stress to patients with the disease, to the family and loved ones of these patients, and to physicians, other providers, and healthcare workers caring for patients with suspected or confirmed COVID-19. Indeed, in the COVID-19 pandemic, PTSD may occur in individuals belonging to all such subgroups. In the present issue of Mayo Clinic Proceedings, Karnatskaya et al. Broadly discussed the emotional and psychological burden mightily imposed by the COVID-19 crisis on providers and patients, and they suggest approaches that may reduce the impact and adverse outcomes caused by such burdens. These authors begin by delineating the reasons why healthcare workers may be inordinately exposed to such stress: the rapid and at times overwhelming surge in patient volumes, the witnessing of patient suffering and demise, insufficient medical supplies and resources, and the need for rationing, and the fear of infection and causing the spread of infection, among others. Karnatskaya et al. Discussed the physiological effects of stress and how such effects become pathobiologic and disease-provoking when imposed stress is either precipitate, inordinate, or unremitting. Notably, the adverse immune effects of sustained stress can itself predispose to infection with SARS-CoV-2. The authors then discuss the physiological and pathophysiologic effects of emotion and attitude, emphasizing the generally salutary effects of a positive outlook on the one hand, and on the other, the unhealthy, including nocebo effects and the propensity for errors in judgment of a largely fearful and negative mindset. All these considerations are then brought back to the care of the critically ill patient, as the authors discuss how such considerations can affect both the provider and the patient and may influence patient outcomes. Karnatskaya et al. Conclude with strategies for staff that may promote resilience, a positive attitude, and the practicing of the golden rule, as well as those that may optimize patient-provider interaction and patient care. Responses to stress are categorized biologically and broadly into those that are adaptive because they mitigate the adverse effects of stress, and those that are maladaptive as they exaggerate the perturbing effects of stress. Karnatskaya et al. Provide a number of important adaptive approaches that can safeguard the healthcare team from the stress and fear imposed by COVID-19 pandemic, and in so doing may improve outcomes for patients under their care. You can access these highlights and editor's choice articles free of charge during the entire month of November. When you visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, you will find links to our social media by clicking the buttons at the top of the home page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights, 60 seconds video article synopses, and our Mayo Clinic Proceedings issue summary and author insight podcast recordings, which are available from our website on our homepage as well as through iTunes. You will also find our online-only feature, Pioneers and Legends in Medicine, which are video interviews of people who've made a strong impact in their field of study. You will find many news stories at our website that are based on articles published in Mayo Clinic Proceedings. And finally, you'll see other free content and articles published online ahead of print. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.